Hi there, this is Debbie Nicholson. I'm the Director of Community Outreach for Beat Cancer, and I'm coming to you with one of our amazing coaches, and they're all amazing. So we're bringing you these podcasts so you can get to know our coaches on a more personal level, so you can see what resonates with you and what hope, help, and healing is out there. So today I have with you Ruth Phillips. She is an oncology nurse and she has a wonderful website, guideforhope.com, and she does cancer coaching and she also has cardiac coaching available. So this is such a wonderful service and we want to hear about Ruth, how she got into this, what her story is. So welcome, Ruth. It's very, very nice to have you here with us.
Thank you for having me, Debbie. This is great. I'm really excited to be here and tell you a little bit more about me. As you mentioned, I'm an oncology nurse. I've been taking care of oncology patients I stopped at 25 years counting, and it's more than that. But I don't like to remember how old I am these days. And I've always had a passion for oncology. I started taking care of hospice patients and helping them have dignity as they passed away. And end-of-life care was very important in making sure that the families had said their goodbyes and felt comfortable with and at peace with where they were. And that moved me into actually taking care of patients, giving chemotherapy and post-surgical patients, helping them know their exercises and how to manage and be empowered in taking care of themselves. And as part of that, I became very interested in educating people in the community about prevention of cancer, because that's really our first line of defense in being able to prevent disease and then identifying disease early on so that we can take corrective actions so that we don't have to go to the end of life care that I started at. But I ended up becoming a cancer coach because there's so many more things that patients need to understand that we don't have the opportunity as nurses at the bedside to talk to patients about. Nutrition being one of the things that I really struggled with. We don't get a lot of nursing education on nutrition. And so finding information on nutrition was life-changing for me. How to incorporate fruits and vegetables into my meal plans was very inspiring. My children haven't yet completely crossed over, but we're working on it together. It's been a change for them.
Right. At least they see what's important to you and it becomes familiar. And I think it's interesting because the same things that prevent cancer also help heal cancer. So
Absolutely.
I think the sooner that we can develop those habits, the better.
Right.
Because in the end, that's what it circles back around to anyway.
That's correct.
Yeah. It's harder to hardwire habits.
Yeah.
So if you can do that younger, that's wonderful. It's nice to be an example. But
Right.
yeah, I think it's also interesting that part of healing you're not learning in traditional medicine, which helps the body heal. So that's really great that you wanted to learn that and start incorporating that.
Yeah, and it's really interesting as I'm taking care of patients today, how they bring up, oh, I want to try and eat better and eat healthier, not just in my coaching life, but in my actual administering chemotherapy life. I'm talking to patients and they have questions about their diet and their nutrition. And so having that knowledge has been very valuable. There's also a lot of other complementary therapies that I've seen work wonderfully for patients, like reiki and massage. And you can just see the pain that's released from patients that have a Reiki therapist at their side, and a lot of the grief that they've experienced, I use that word loosely, because of their disease, can be alleviated using Reiki. So it's really exciting to be able to bring those complementary therapies into play. Mm-hmm.
Yeah, because we're all energy, and to heal from cancer, the mind, body, spirit connection also needs to be addressed. And
That's right.
sometimes there's just energy blockages that
Mm-hmm.
Reiki can help with, and having that human connection is also so wonderful.
Very important. Yeah. I know we had talked about an example of a patient that I had been working with, and probably one of my closest friends now, who was a patient when I met her, came to me because she was just petrified. She had been diagnosed with stage 4 colon cancer, and she didn't know what to do. And just talking to her and beginning to work through different steps, I call them, helping her to understand the diagnosis that she has, because half of the language that physicians use, patients don't understand. And we know that, but unfortunately, we haven't gotten to the point where we're always speaking on a level that patients understand. So translating for her, and then we work through Kelly Turner's book, Radical Remission, together, and helping her understand steps of, incorporating prayer and meditation into her life, making sure she was getting exercise. And she had gotten to that point where she was so scared to do anything that she sat on the couch and didn't move. And I'm like, you can't do that. You have to get up and move around and stop worrying about stepping off the couch causing you to progress. Step off the couch, because that's going to make you heal and help you heal. And she started doing yoga again, and she's doing fabulously. She changed her diet and incorporated a lot of those principles that we know make a difference for patients. And you see that positive attitude even from a medical perspective. Doctors will tell you, or oncologists will tell you, having a positive outlook, those patients always do better. I don't think the medical world has documented like they would like to how that positive outlook affects patients or impacts patients, or why it impacts patients, but they know it does. And so starting with a positive outlook and building on that, incorporating different activities into your life, that such as nutrition and prayer, can really make a difference for patients.
Yeah, it's really important. People can stop and really connect with themselves and connect to what is authentic and what brings them joy. And, I guess you have to believe you deserve that. It's
Yeah.
kind of maybe a new practice for someone to nurture themselves, bring themselves good nutrition,
Yes.
rest, find things they enjoy.
Mm-hmm.
Yeah, that positive outlook. And I was just talking about Dr. Bernie Siegel, and we were talking about, not seeing cancer as fighting an enemy, because that takes energy away and gives that power. Instead,
Right.
cancer's part of you. So instead, try and figure out what the cancer's trying to tell you and why you got this in the first place. And then
Right.
start bringing joy. He said to find out whatever your chocolate ice cream is.
Isn't that great?
Yeah, interesting, because the medical community is definitely seeing that what's helping and what works, and I think that things are starting to shift.
I agree. Yeah, there's definitely a lot more, at least discussion about complementary medicine in oncology. I mean, if you look at Cancer Treatment Centers of America, they have specialists within their organization that talk to patients specifically about complementary therapies. It's finding that balance, you know. You don't want to go to one extreme, and if that's not appropriate for your situation, or to the other. Unfortunately, I think sometimes the strict medical community tends to avoid the complementary because they're afraid of it. They don't know enough. If you look at the American Society of Clinical Oncology, there's not a lot of information that's provided at this large meeting or conference of oncologists related to complementary therapies. They stick to what's tested in the lab and what's done in clinical trials, and getting the education to the physicians can oftentimes be challenging.
Yeah, and I think we're starting to realize that we're mind, body, spirit. So all of that has to be addressed. So I think it's great that hospitals are starting to have massage and Reiki and things that are wonderful, because there's awareness.
Right. And it does help patients.
Yeah. So tell me a little bit about your coaching business and what you believe in and how you like to do things.
So Guide for Hope was really a coaching business that started organically. Friends and family would call because they knew that I had been working in oncology for years and could help them understand what the doctors were talking to them about, help them understand the side effects of their treatments. And I think that's really been the basis of Guide for Hope, is providing support and education, and letting patients really choose the path that's right for them, giving them options so that they're empowered, helping them to be able to identify places if they feel they need a second opinion, helping them to identify physicians that would be appropriate for a second opinion. I've had the fortune of working with MD Anderson, the National Cancer Institute, Dana-Farber, and a large number of large academic institutions throughout the United States in my career. So having connections at those places oftentimes can allow for quick referrals if patients feel the need for a second opinion. And I think having a partnership with your physician is so important. Not only when you bring in complementary therapies, but when you're taking standard treatments, if you don't have an open and honest communication with your physician, they're not going to be able to treat you effectively and give you the medicine that is effective for you. If you're having side effects and they don't know about them, that's not helping anybody. So having that conversation with the patient that, one, if you choose to take standard chemotherapy, you need to be open and honest with that physician and ask the right questions. If you're choosing to use complementary therapy, there's also questions. If you're going to use complementary therapies in combination with chemotherapy or radiation, make sure that there's not interactions that would be, harmful to you, making sure that there's time between each activity that you're engaging in, so that you get the best results with what you're doing is really important. And I think, again, letting patients choose their path, but giving them an ear so that they can talk through what they're feeling and what they're thinking about is really important. Oftentimes, patients work out their situation on their own. They just need somebody to hear them. And it's kind of hard when it's all just in their head and not verbalized. So oftentimes, that's the best place for me to kind of connect with patients, is just listening.
No, that's really
Thank you. And you did mention that we have a cardiology section. for a Guide for Hope. One of the nurses that I've grown up with is a cardiology nurse, and as an oncology nurse, there's a huge connection between cardiology and oncology, and we're seeing a lot more of the medications impact blood pressure and heart rate, and other, heart type, causing swelling, long-term heart failure. And so incorporating that cardiology component to help patients that are experiencing those side effects just hopefully will strengthen that education and support that we're able to provide.
Well, that's really wonderful. That's comprehensive, and
We're trying.
your clients must feel very supportive.
Yeah, we oftentimes get the comment, or I guess one of my favorite comments that comes back is, "You're a shelter in the storm." And so that just makes you feel that you've really been able to be successful in meeting the needs of the patient or the client.
That's really wonderful. So tell me, how did you feel that the course with BeatCancer, did that help you?
BeatCancer, the course with BeatCancer was amazing, actually. And I have to be honest, I kind of was a little hesitant at first, like, what am I going to learn? How is this going to help me? But again, going back to that nutrition education it was something that was completely eye-opening to me. And it's something that I've had to take an active step in incorporating in my life, because it was not something that was taught to me in college. Even when you look at the American Cancer Society's recommendation, it's eat better, more fruits and vegetables, but it doesn't talk about necessarily all of the different combinations of foods that can help. It doesn't talk to a lot of the specific foods like tomatoes for prostate cancer that can be helpful in certain situations. So I feel like I'm constantly going back to those notes to refresh that information for my patients, because that's something that they can use immediately. If I say, "Oh, you have prostate cancer, you start eating more tomatoes," you can't obviously make your whole diet tomatoes, but incorporating that information into their diet is very important. I also really felt that the section on, and it was the psychological or emotional states of patients and where they've been in their past is very important. I was talking to a lady the other day and who has cancer, and one of the things that she said, and it was kind of out of the blue that she said it, was, "I never got over my parents' divorce." And I said, "I think that's something that you need to take care of. Like, we need to explore that a little bit more." And you could just see the weight begin to drop as she started talking about what had happened. And even though it doesn't immediately cure anyone, getting rid of those, like you said, those blocks of energy, it begins to open the doors to healing. And
Right. Intuitively, people know why they got cancer. And I think if people can look at it as a way to start to listen and go deeper and honor what needs to be healed and make
yes,
changes, it can be life-saving.
exactly. And that's exactly what I was beginning to see, and it's only been a couple of days that we've been talking, but you could begin to see that she was healing from the emotional problems that she was dealing with, which would then allow her to move forward. So I think they were my two favorite parts of the course.
Me too. I have to say, me too. Because then you feel like you have a comprehensive, because cancer is multifaceted. you know,
Yes.
and everyone has a different root cause, but it's nice to understand the root causes from a comprehensive nature. And
Absolutely. And
yeah,
to know what to listen to from those perspectives. Again, that emotional connection isn't something that you learn in nursing school or in medicine. And it's not really even talked a lot about in a lot of the oncology journals that I read. But it's there, and we can always say, oh, well, there's, a patient profile that fits, certain types of cancers, but that deeper emotional state, it's really been eye-opening for me. So
well, how
excited.
wonderful that you were there to listen to her, and
It was great.
you were equipped with what to say too. I mean,
Yeah, I know. It was wonderful, and she's been so grateful, and um, it's been really great working with her to see her just kind of progress and feel more confident and more empowered in her care as well. So
that's wonderful.
mhm.
Really great. Where are you located?
I'm actually outside of Philadelphia in a place called Collegeville on the King of Prussia side of Philadelphia.
Okay, well that's accessible from a lot of areas.
Yes. Yes.
Yeah.
Exactly.
That's the
Not
main
hard to
hub.
get to. 2 hours to New York City, 2 hours to, well, 3 hours to DC.
And not far from Philly.
That's right.
Yeah.
It's a
Okay.
great part of the country.
Do you deal with all different hospitals?
I do. I grew up at Fox Chase Cancer Center. That's where I had all of my oncology nursing training. But now I work with most of the suburban hospitals, as well as some of the major cancer centers that I've talked about, like MD Anderson. There's a few physicians that I work with there. Dana-Farber, National Cancer Institute. So still keep in touch with them, and occasionally they'll refer patients that are really struggling over. So it's exciting.
That's great. Okay, well, thank you so much, Ruth. And you can find her at guideforhope.com. And I'm sure she's available to answer any questions you might have. You can find her on our website, BeatCancer.Org, under Find a Coach. And it's just wonderful to see things shifting, and just a real open-minded type of care for patients, where we're addressing comprehensive needs and things. So it's
It's
so
great.
nice to hear. And thank you so much for providing these much needed services. We're filling in gaps and we're helping people. So it's just a wonderful thing.
Absolutely. Thank you for having me. I appreciate it.
Thank you. Great. Well, look her up and you can find her online. Thanks, everybody.